Hi, good afternoon, everybody, and welcome. My name is Jen Elder. I'm the director of the SAMHSA Homeless and Housing Resource Center, and we are so excited to be presenting this webinar in partnership with the SAMHSA-funded National Family Support Technical Assistance Center. We have some great content for you today. Just a couple quick housekeeping items from me. We are so excited to be joined by so many people. All of your lines will be muted, and the chat feature will not be enabled today for attendees because we have so many people, but you can contact us through the Q&A feature. We also, as you see, have ASL interpretation as well as live captioning if you would like to turn that on your end today. The slides for today's session and the presenter bios are available on our website. Kevin from our team will put that link into the chat for everybody. We appreciate you taking a few minutes at the end of today's session to complete an evaluation. And everyone who completes that very short evaluation will be directed to a certificate of participation for today's webinar. Just a note that we don't offer CEUs for this webinar. So we are so excited today to hear from Abigail Kirkman, the Assistant Director of the SAMHSA SOAR Technical Assistance Center, and Clarissa McGee, the Mid-Oregon Regional Manager with the Oregon Family Support Network. Since we only have 60 minutes today, I will keep my part short, and I will just do for the next slide a quick disclaimer. Both of our centers are funded by SAMHSA, but all of the information, it doesn't necessarily represent SAMHSA or the US government. With that, welcome, Clarissa. Thank you so much for joining us today.
Hello. Hello, everyone. I would like to start off by sharing some statistics. Excuse me, there are approximately 1.5 million people listed as being without homes. Estimates show that number is actually much higher than what is reported. Families experiencing homelessness are typically referred to as the hidden homeless, often doubling up with family or friends or staying in shelters. I cannot imagine what staying in a shelter would have been like with my kids. Many families experiencing homelessness have needs beyond housing that have to be met in order to maintain stability. The needs of their children are first and foremost. At any given time, there are approximately 1.3 million students experiencing homelessness. The hidden homeless, so living with others or doubling up, carries more risk for families than living in shelters. They experience frequent moves, changes in school, and increased worry and anxiety about overstaying their welcome. I'll talk some more about that in just a minute. Families with children who experience mental health issues or special needs have extremely complicated needs over and above the issues of being homeless. These needs such as mental health treatment, medication management, financial assistance, and special education assistance. So this is my story. I am the mother of 5, 3 boys and 2 girls, now 4 adult children. I lost my son earlier this year. My children and I are the survivors of domestic violence. We each have our own diagnoses with varying degrees of severity. We lived in a very sweet, very small house in Portland that we all adored, but we had to leave. So we fled and we shared one room in my mother's house between 5 people and 2 dogs. When I wasn't working, we were living in my van in the driveway and staying and looking for a place on our own while trying not to irritate my mother. And that's what I was talking about earlier. When you're staying with family, sometimes family relationships are toxic and really hurtful things can be said and done. When we were finally settled, I had super high hopes. My children, especially the younger 4, displayed extreme behaviors in their youth. You might notice that I said extreme, extremely loud, and extremely disruptive. There was lots of property damage. Our neighbors complained, the landlord complained, I complained. With extreme behaviors comes extreme expenses. We were able to stay in our first apartment for 8 months. My children broke closet doors, broke a window, left marks on all of the doors, and we did not get our deposit back. Also, that means we did not have that great of a rental reference. After that, things got consistently more expensive and difficult. I was able to get us into a house, a rental, but it was a house. And I felt that we would be more successful if no one lived above us, below us, or beside us. I had it all planned, enough bedrooms for everyone to be separate. The first and last month's rent and the security deposit took everything I had. I even sold jewelry and sold some things to make up money to move. More property damage. Once you get settled into a neighborhood, then you learn about your neighbors, and your neighbors are learning about you. So what we learned is that the people in our neighborhood hated us, and they made it well known to everyone. The police were called numerous times due to out of control behavior. At one point, we received an anonymous letter from an angry neighbor. They wanted to make sure we knew how much they disapproved of my kids, of their behavior, and my parenting style. We all experienced bullying as well. And we had to move. Every time we move, which that was very often because of situations like what I was saying earlier. And also the costs increased. Sometimes double security deposits, first and last month's rent. We never received the deposits back either. I became an expert at painting and repairing walls and light fixtures. I've learned many lessons along the way and dedicated the last 10 years of my life to helping other parents and children find and keep stable housing, but also to navigate child serving systems so they don't have to experience what my family experienced. As a peer support specialist, I have worked with parents on learning new and different parenting skills, seeking mental health treatment, and learning how to navigate systems. Peers can educate parents about navigating systems, finding resources, educational information, fair housing laws and discrimination, collaborating with property managers in housing, advocacy, empowerment, filing complaints and grievances, reasonable accommodations, and networking. And that is the end of my presentation.
Thank you. Thank you so much, Clarissa, for sharing your really powerful experiences. It's such a great framing to the rest of this webinar and the resources that we'll be sharing. So I am super excited to be here with you guys today to discuss SOAR and share about this initiative and share about how it can be such a powerful and life-changing opportunity for those families and children who are disabled and are greatly in need of benefits that can help to stabilize them. So SOAR, what is SOAR? SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. It is a model, it is a method, it is a process of assisting eligible individuals, both adults and children who are disabled and unable to work, apply for Social Security disability benefits. We use a very broad definition of the term at risk of homelessness. So this could be people who are living doubled up, or some people who are living in permanent supportive housing with family, or anywhere that's unsuitable. If you are working with or have family members that are not able to maintain their housing because of their disability, SOAR could potentially be for them. Overall, SOAR is sponsored by SAMHSA, and we've been working in collaboration with the Social Security Administration since 2005. And SOAR is everywhere. SOAR is in all 50 states and in some capacity, but we're always looking to grow, and especially when it comes to SOAR for children, which is the newer of the two models. We've been doing SOAR for adults and doing it successfully for well over a decade. But with this opportunity, we're really looking to expand SOAR for children and help those families and children that are most in need. All right, so let's talk a little bit about the basics. So the Social Security Administration generally offers two forms of benefit programs, SSI and SSDI. Now, children are only going to be eligible for Supplemental Security Income, or SSI. These benefits are for low-income individuals. And because it's for low-income individuals and it's really the program of last resort, financial need and a complete picture of the income, the family's income, living arrangements, family resources are taken into consideration to determine eligibility. SSI is available for children of any age, so 0 to before they turn 18, who are disabled or blind. And it comes with a federal benefit rate of $794 a month. Now, that will sometimes fluctuate after the first of the year. It may increase $10, $12, $2, and so it will change from year to year. And along with SSI, Medicaid is generally provided in most states. So how does the Social Security Administration determine disability, and especially and particularly disability for children? So when we're talking about disability, we are referencing either physical or mental health diagnoses or a combination of both. And these diagnoses need to be documented. So this would be by a child's treating physician, pediatrician, psychologist, or psychiatrist. And this disability needs to be expected to last 12 months or more or result in death. Now, how does this differ from Social Security for adults in that disability? Because most of us are probably very familiar with the adult definition. It can't work. So that's what Social Security is assessing. But with children, oftentimes children are not going to work, or if they have gone to work, they have not had that longevity in the workforce. So what SSA is looking at is that they are looking at the child's functional abilities and functional limitations compared to a child of the same age that does not have the mental or physical health impairments. So let's take a 10-year-old who suffers from a mental and physical health diagnosis. They are going to take a look at that child's functioning and really look at the whole child and that whole person. And they are going to compare it to the functioning of a lay child or a child that doesn't have those disabilities. So this could be in terms of schooling. It could be in terms of play, because for many children, play is like their work when we are thinking in terms of abilities and functioning. How do they function in school? How do they get along with others? How can they follow directions? How can they manipulate objects? So there's so many things that Social Security looks at, and that's why that documentation of a disability and really painting a full picture of the child is going to be so important when it comes to Social Security's determination. So when we're thinking about applying for benefits, Social Security is going to have what's called, it's a fancy, the sequential evaluation, which is a fancy way of saying this is how they determine if a child is eligible for disability benefits. So you'll see here a couple of things, and really it's a flow chart. We're going to look at it from left to right, and we're going to answer these questions in order, and then our goal is to always get to approval. So the first step in the sequential evaluation is the child working, and are they earning SGA? And SGA stands for substantial gainful activity, which is a threshold amount that they will measure ability to work by. So for the year 2021, that is $1,310 a month. So if the child is earning over $1,310 a month, they will be deemed ineligible for benefits because they are working. Now, we know that most children are not, and even some teenagers are not working at that level, or they're not working at all. So if the child is not working, or they are working, but they're not earning that substantial gainful activity, they are then going to go over to the second box. Does the child have a severe impairment? And this impairment needs to be documented. So do you have medical documentation of this impairment? And if the answer is no, then they're going to be denied. However, if the answer is yes, they're going to go on to the third and final box. And this is really where SOAR and having folks involved in this process really shines. So the question is going to be, does the child's impairment meet or medically equal a listing or functionally equal the listing? Now, we could spend all day getting into the listings. If you're interested, you can Google SSA Blue Book listings for children, which is a listing. So the listings are essentially a listing of impairments, and then it will talk about the severity that's needed and the functional limitations that are needed in order to be eligible for benefits. And why becoming involved in this process, and why this process is often so challenging, and why it is often hard to get approved on initial application, is because oftentimes people will say, well, my child is disabled. He has a diagnosis of ADHD or bipolar disorder. But where they fail is they don't go the extra step and say, due to this diagnosis of ADHD, due to this diagnosis of autism, they are unable to function. And here's how they're unable to function. So with SOAR, one of our goals is really to paint a picture of the applicant, paint a picture of the child, and present that to Social Security and the DDS, which is the Disability Determination Services, who make the medical determination, so that they can easily see, yes, this applicant is disabled, yes, they are going to be approved, and put them into pay status as quickly as possible. So, but what we know overall, while Social Security benefits are incredibly important, and they are, it is just one brick in the foundation. You'll notice that on our house here, we have SSI and SSDI benefits, SSI for children being at the lower left-hand corner. What we hope with that is that as folks get benefits, as they get income, they will be able to become more stable. So perhaps employment is in their future, whether it be now or down the road. They'll be able to access Medicaid. And then that will lead to additional treatment, additional housing supports, and overall wellness, recovery, and resiliency. Because at the end of the day, that's what we want. We want well children. We want resilient children who are going to be able to go on and do whatever they want with their lives. And SSI and SSDI benefits can really be one key piece of that. And we know it's more than just income. Like I said, access to healthcare and housing, increased educational and employment opportunities. Social Security for both adults and children offer a wealth of employment opportunities and opportunities to save for educational expenses. And what we also know is that when individuals have benefits, so access to SSI, access to housing, you're going to see a decrease in adverse outcomes. And what this means is incarcerations, time in juvenile detentions, time in group homes, or hospitalizations. And this could be anywhere from being institutionalized all the way to going to the emergency room or just seeing the doctor often because they are more stabilized. All right, so by now, some of you may be thinking, so what is this SOAR thing and what makes it unique? So your SOAR superhero right here is here to tell you exactly that. So SOAR operates on what are 5 key critical components. But really, if I could sum up SOAR in one word, that word would be proactive. Caseworkers, family members, school counselors can become trained in how to use the SOAR methodology and how to use the SOAR process. And then you can apply this to help children, young adults, or even adults in your community. SOAR overall is not a specialized process. It's not like we're filling out a SOAR application. Instead, we are using the tools that the Social Security Administration has given us to the fullest. And we are using all of the things that they've given us, providing a complete application to Social Security. And then they are able to make, hopefully, a quick approval on the decision. That's really what it's about. It's about providing a complete application to the Social Security Administration so that they can make that timely decision. So through that, we are going to serve as the applicant's 1696 representative. And this is really the key to the city in so many ways. With the 1696, you as the adult figure, as the caseworker, as the teacher, as the guidance counselor, you can communicate with the Social Security Administration on the child and on the family's behalf. So they don't have to go through the bureaucratic processes and the busy signals on the line. You can handle that for them. We are going to collect and submit all the applicant's medical records so that the folks evaluating the child's claim can get a full picture of the child. If we have a 16 or 17-year-old that we're working with and they received a diagnosis 10 years ago, let's be those clinical Columbos and try to get the medical records from way back so that they're not just looking at the medical records from this week or this year, but they're really seeing the full picture of the child's history over time. We are going to use those medical records and we are going to write a medical summary report. And this medical summary report is a narrative. It's a letter that we give to the Social Security Administration, and it clearly outlines the applicant's medical history, but not just the medical history. We talk about their personal history, if there's any trauma, how they struggle in school, perhaps their substance use issues. We also talk about their functioning, and we very clearly address each of Social Security's areas where they are going to assess that functioning. So when they go to make the decision, all of a sudden the child isn't just a pile of medical records. No, the Social Security and DDS, they are going to see John, or they're going to see Caitlin. They're going to see an actual person in front of them, even though they'll never actually see them. Through our writing and through the information we provide, we are going to let them see them and their functional limitations. We are also going to help them. We're also going to hopefully obtain a co-signature on this medical summary report. And when we do that, that medical summary report is going to be elevated to medical evidence. So what we as caseworkers, as parents, as caregivers write will be considered medical evidence. And at the end of the day, we are going to provide a complete and quality application to the Social Security Administration. I have done many of these, and it's such a great feeling to go down to Social Security, hand them this packet, or, in the times of COVID, fax it or mail it, and then look at it and say, wow, this is everything we need. We're going to be able to complete this application relatively quickly. So how do we know this works? So SOAR as a whole for adult applications, I'm including adult applications in this, has an average approval rate of 65%. Now, this is incredibly impressive when you compare it to the average approval rate of lay people who apply. So if someone is not experiencing homelessness or they have support, if they go in and apply for Social Security, the likelihood that they're going to be approved is about 29%. If someone is homeless or at risk of homelessness and they go in and apply for benefits, the likelihood they'll be approved is about 10 to 15%. So we are quadrupling that. We are seeing an average approval rate of 65%. And with this year's outcomes, which are very soon to come out, we are really happy to say that we have eclipsed over 50,000 applications, cumulative initial approvals. And that means 50,000 people whose lives have been changed and who have benefits because of the SOAR initiative. This is also in about an average of 115 days. So I am sure that all of you have heard the myths that you have to be denied 3 times in order to be approved for benefits, or that you have to go to multiple levels of appeals. But what we're seeing with SOAR is an average approval rate of 65% in an average of about 115 days, so about 3 months. And that's huge. That can be life-changing. Next slide. This is also really beneficial when we're thinking in terms of financial reimbursement. So it's not just about having folks have income moving forward, but there are also additional financial outcomes. So average general assistance reimbursement. So many states and communities, if your community is giving general assistance while someone is able or is waiting for benefits, or before they have benefits, they will be able to be reimbursed. So on average, for every person that gets benefits, money is coming back into your community in terms of reimbursement to that pot. So that's about $3,100. Also, the average Medicaid reimbursement can be really impactful. So this means that states where the person is not covered, they don't have that health insurance, hospital providers, treatment providers can recoup the cost of uncompensated care once someone is approved for benefits. And that's on average over $10,000 per applicant. And we also see an average retroactive benefit of about $6,000. Now, this is inclusive of both adult and child applications, not necessarily just child specific, but you can see that this is not only bringing money to the applicant, but it's bringing money back into your community. And it's putting people on federal dollars and overall making them better citizens of their community because they're able to pay rent, because they're able to grocery shop, they're able to go out and do fun things with their kids, which is so important to community. So let's talk a little bit about child SSI specific outcomes. So again, we are going to be debuting our new outcomes very shortly, but in 2020, many states have seen a really high approval rate and significant child applications coming through. So on average, we have a 72% approval rate for child applications in approximately 107 days. So we're talking about 3.5 months from the time the application is put in to when youth, families, children are getting money in their pockets. And so currently we are around 600 decisions. I am hopeful that that will amp up to about 1,000 decisions once we get our outcomes in for this year. So like I said, the adult curriculum and the SOAR for Adults has been around for a long time. And SOAR has always assisted with child applications. But what you'll see in a couple slides is that in the past couple years, we have debuted a course for children, and we really are focused on expanding SOAR for children because we know how to serve the adult population, but we want to be able to serve children and youth just as successfully as we have for the adult population. So to this end, we have created some resources, guidance for parents and caregivers, and then also in the next slide, how communities can assist. So I know that there are many parents and caregivers on here, and there is so many ways that you can become involved in this process. You yourself could become trained in SOAR, and you could help your child, your relative, your guardian. You could help them apply for benefits. Or you could also work to connect with SOAR providers in your community and promote the initiative throughout your community. Or if you're already working with an agency, talk with them about how you can promote the SOAR initiative or get them trained. But you as parents and caregivers can be such a great asset. So by providing information about the child's functioning at home, at school, in the community, the information that we as SOAR trained caseworkers will need to be provided, we'll need is going to be, we're not going to know everything because we are not at home with them. We're not in the community with them or at school, but you are. So can you help us by documenting their functioning? Also, assisting with identifying medical providers and educational documentation that can be helpful, and connecting with family peer networks in your area and others that are going through this process similarly. I can speak from experience that having a connection and a relationship with a family member can be so key to the process. A couple years ago, I worked with someone who was 22 years old. So not a child in the mind of SSA, but their application, their diagnosis was at age 2 or 3. And we were working with this applicant who was residing at a local homeless shelter. And all we could think was, man, how are we going to be able to show that this applicant's disability started 15, 20 years ago, because that documentation more than likely isn't held still at the records facilities. And so we thought, let's call grandma. He gave us permission. We went over to see his grandmother. We brought her some flowers. We pet her cat. And she provided us, I am not even kidding, it was probably 1.5 foot stack of medical records. And that was the game changer in the application, because we were able to show from 10, 15, 20 years ago that this disability has persisted. So it really is a community effort. It's a family effort when you're working with someone to apply for disability benefits. And as a community, if you are a caseworker, if you are the head of an agency or a program supervisor, I really encourage you to figure out where your agency can assist in the SOAR process. So can you have SOAR trained staff at your agency? And on top of that, that's a really great question to ask. So if you are an agency and you frequently find yourself needing to apply for Social Security disability benefits for children or for families, what do you do with them? How is it going? Is it successful? And if the answer is no, or sort of, maybe sometimes, this is really the opportunity for you to engage with SOAR. And maybe it's not, maybe you can't have SOAR trained staff, but can you help with identifying applicants? Could you potentially help with the application? If you are a treatment provider, can you help with obtaining those medical records, sharing them, or helping with the evaluations or co-signing on MSRs? Can you provide systems level support? So for instance, if you are a mover and shaker in your community, can you promote SOAR? How can you get the word out there? And another really important part of this is, how can we promote recovery and resiliency? So after the child, the youth, the family has these benefits in place, what's next? Can we get them into housing? Can we get them into employment supports? Can we help them with childcare or educational needs? SOAR is so much of a community approach. It doesn't work when it's just an island of one person doing applications. It really works best when it's an overall community effort, and each agency, each person has a piece of the pie. All right, so I hope that you guys are interested in becoming involved in this initiative, or are excited to spread it around to other folks who could become involved. So at its core, SOAR for Children is an online course. You need to become trained in this process. So you become trained in this process through the SOAR online course, which is located on the SOAR Works website. The course is free, completely free. It is open to the public, and it helps to standardize training from all across the community. So I know that the people who are being trained in my community in Albany, New York, are getting the same training as the people in New Mexico, same as in Illinois and Montana. So that regardless of where we are, we're all kind of speaking the same Social Security SOAR language. Like I mentioned earlier, SOAR is also active in almost every state in some capacity. So there are many SOAR local leads for both adults and the child curriculum that are willing and ready to assist you guys with getting trained up in this course. I mentioned that it's free, it's web-based, it's self-guided, and both the child and the adult course come with 20 free CEUs through the National Association of Social Workers. Next slide. So the thing we wanted to convey most is that we did not want to have a dry course by any means. We wanted it to be interactive. And I think that's really what stands the SOAR online course apart from other courses that you will take. not only are you reading articles and learning about the process, but you also are assigned a practicum. So you're either going to be assigned Tiffany on the right. Tiffany is a 16-year-old who is homeless and living in a shelter, or you are going to be assigned Marshall. Marshall is an 8-year-old, and this is Marshall's mother. You don't actually interact with Marshall, you interact with their guardian, their parent throughout. And you will complete all 4 Social Security forms and a medical summary report for each of your mock app or for your mock applicant that you are assigned. At that point, you are then, once you finish it, it is going to be sent to the SOAR Technical Assistance Center, and we are going to review your application, your mock application, line by line and give you real-time feedback. And once you have completed that, once you have passed the course, then you are considered SOAR trained. You will be connected with representatives in your community, and you will be connected with your SOAR TA Center liaison. Each state has a liaison. You are more than welcome to go and check out who your liaison is. And we are incredibly accessible. We do SOAR all day, every day, and we are eager and willing to support everyone throughout the process. So once you complete the training, you will then be able to do SOAR applications with folks in your community, with children, with youth, or adults if you choose to do the adult course. And that's really the overall goal, to get folks trained to be able to assist with this process and get those really positive outcomes. So one of the key documents that we talk about a lot is getting involved with SOAR. We want to be upfront with you about how long this process takes and the expectations of it. We estimate that the course takes 20 hours to complete, and that in many ways will mirror the amount of time that it takes to complete an application. In a traditional caseworker setting, we estimate that an application will take 20 to 40 hours to complete over the course of 60 days. And the amount of time that it will take, that 20 to 40 range, it's pretty big, but that will depend on the amount of time that you need to engage with the applicant. So if you're working with someone, a child or a youth, and they're living in your family shelter or in your Housing First program or whatever, it might be less. It might be on that 20-hour end. But if we are working with individuals who are homeless, maybe a teen that is street homeless and really requires a lot of engagement to get to know, it may be on the 40-hour angle. We want to make sure that before you become trained, you have that expectation. And if you are a supervisor or a program director, you know that there are expectations of this process and that it will take time, but it is so worth it because you are going to get that 72% approval rate on average in an average of 107 days. That can be life-changing for families. We also want to ensure that you're tracking all of your outcomes in OAT, which is our online application tracking system. It is HIPAA compliant, it is free, and that's how we know that you guys are doing the work. And we want to be able to celebrate you. And the more we're able to show that this great work is being done, the more funding we can ask for and say, hey, can we get some dedicated SOAR positions because we're seeing these approval rates for children and families. And at the end of the day, SOAR is going to benefit your agency. You're going to be able to help those children and those families more quickly than you would the traditional way, which oftentimes will mean various levels of appeals and may take upwards of a year or two to get your benefits. And the more you're able to help families move on, get them stabilized and into housing, the more people you're going to be able to serve in your community. So at the end of the day, I really hope that you guys will, I hope you're interested in SOAR. I hope you can see the value of it. And I know that myself, I speak for the whole SAMHSA SOAR TA Center when I say that we look forward to engaging with you, whether you are a parent, a guardian, a community member, if you are a peer, or if you're an agency of any kind, both for SOAR for adults, but mostly for SOAR for children. All right, I think I'm going to hand it back off to Jen.
Great. Thank you so much to Clarissa for sharing your story. That was so powerful and impactful, both for those who are hearing it and identifying with your story, saying, I have been there and I have, had those barriers and overcome those, as well as people serving families who are experiencing homelessness. It is so important for our providers to hear that real story of all of the various things that you're going through and the systems that you're interacting with. It's not just us when you're coming to, say, a case manager, you're interacting with a number of systems. So thank you for sharing that insight. Abby, thank you so much for sharing about SOAR. We hear so much about it, or interest in our HHR community saying we want more SOAR. So we do have 20 minutes left. And so I will try to invite Clarissa and Abby to answer kind of as many questions as we can get to. I will say in the Q&A, we've put some links into the disability and the listings, but we'd love to just talk more. So actually, you see the follow-up, we'll go over that at the end of the webinar too, so we can take down the slides and have just a little close round robin for us. Perfect. So Clarissa, I wanted to start with you, going back to your slides, really talking about all of the systems that a family is navigating. What would be your advice to a family who's in that crisis? Where should they go in their state or community or anywhere? Where would they turn to help and find those resources?
That's a great question. Often communities have what is called a clearinghouse, which is one agency for everyone to come through that door to get services. So I am located in Oregon, and the first thing I did was search out the county that I live in, their webpage. And then that gave me a jumping off point to find all of the resources in my area. So starting with the county.
Thanks so much. It's a great place to start. Thanks, Clarissa. Abby, I'm going to turn to you. We got lots of SOAR questions. Some I think were answered throughout your presentation about how to take the training. Can anybody take the training? So I'm going to try to get on some of them. Can you just maybe reiterate, because it was the beginning, about this whole list of disabilities? Does it have to be with the DSM-5? Does it have it's a very convoluted, confusing system.
Yes.
We'll go to start and get some more information about this list of disabilities.
Yeah, so Social Security has its own, what it's called, the SSA Blue Book, or a list of disabilities. Again, encourage you to Google SSA Blue Book child listings. And so it's not the same as a DSM-5, although in many ways it can be very similar, but there is no need to have a DSM-5 listing and then a Blue Book listing. So the Blue Book for children, they separate them into body systems. So they'll have, for instance, mental health, musculoskeletal, and other things like that. And so they have categories of listings. So it may be, schizophrenia or post-traumatic stress or eating disorders. And for each of those, they are going to outline what you need to have in the medical records and the medical evidence in order to show that the applicant is disabled. But medical records alone are not enough. You also need to speak to the applicant's functioning, which is how we get into that meet or functionally equal a listing. So Social Security is going to ask, how does the child function in comparison to a child of a similar age that does not have this disability? So I could talk for hours about this, trust me, but know that this is something that we go over really thoroughly in the SOAR online course. And if you're interested more in it, I would recommend taking the course, but also checking out the Blue Book listings online.
Thanks, Abby. And a quick question related to medical evidence, and then we'll turn it back to you. A question I have for Clarissa. When you talked about that medical summary report and getting that signed, there was a few questions in the Q&A just about who signs that.
Yes. So that's a great question. So Social Security has what's called acceptable medical sources. And so it's a list of a number of number of folks that are able to sign. So this would be MDs, PhDs, psychologists. I actually pulled up the list right here. Qualified speech pathologists, ophthalmologists, school psychologists. Unfortunately, LMSWs, MSWs are not on that list, but it's essentially someone who has treated the child, the youth, the applicant, and has knowledge of their disabilities and their functioning. If you're interested in knowing the specific list, you can go and look up SSA, acceptable medical sources. Now, as SOAR trained caseworkers, we would write that MSR, but essentially what the acceptable medical source is doing is just signing it, and via their signature, they are saying, we concur with what you have written. And then that is going to elevate it to medical evidence.
Thanks so much. And a great extra plug for the SOAR online course, Child Curriculum, which goes into much more detail with that. Clarissa, if you are here, wanted to get your input. What advice would you give to providers in the system on working and helping them to navigate these multiple systems? What would you say, if you had all the case managers and providers ear right now, what would be your words of wisdom for serving families?
Boy, that's a huge opportunity to have. And anytime I do have a professional's ear, I will use phrases like, in my experience as a parent, can you help me understand why you're having this answer, things like that. But mostly my go-to phrase is, this is your work. This is our life.
Love that. Thank you. I think that's really powerful advice for providers to hear, to really, I think the more that we can humanize this work, and you mentioned, listening. I think that's so important, this active listening to people about their needs and being self-directed from the family. I think that's so important. Thanks. Another question, going back, looking at the SOAR questions. Abby, could you just tell us real quick again how to find SOAR in your area? There was a lot of questions, people interested in SOAR, not able to do it themselves. How do we find where SOAR is?
Yeah, that's a great question. So on the SOAR Works website, right at the top, there is a tab that says SOAR in your state. And you can go ahead and click there. It'll come up with a map of the US, and you can click on your state. Each state, for the most part, has a SOAR state team lead, and every state has a SOAR TA Center liaison. These liaisons are dedicated to SOAR. They work at the SOAR Technical Assistance Center, and we'd be more than happy to be able to find out more information from you. I will caveat this by saying, though, that typically there are not community SOAR caseworkers. And what I mean by that is, rarely am I able to give you a name, you call them, and they're going to be able to take on your applicant the next day. Typically, a person will need to become enrolled in the services of this agency, and then they would be able to work with them. SOAR will also ebb and flow in various areas, so it may be strong in some areas of the state and not so much in others. But where we don't see SOAR, that creates an opportunity for us to build SOAR. So we really always recommend that if you have any capacity within your community or your agency to do SOAR, it's always best to serve your own applicants, to serve your own community members.
Thanks so much. One question that came in, and I know that Clarissa was responding to it in the Q&A, but I thought it was great. It came up a few times, just about working with schools too, and advocating in the education system. And Abby, you'd mentioned that too, is that's a great system to collaborate with. So I guess maybe a two-part question. One, Clarissa, if you could just reiterate your tips for advocating, either as a family or on behalf of a family.
Absolutely. So in Oregon, we have an agency that is called FACT. And I believe there are many organizations like them across the US. They are advocates for families in schools. the first thing that I say to a parent when they're asking for help is make sure that they have a written evaluation from a psychiatrist or a psychologist or even a therapist, which describes what it is that why they're needing the IEP. And then always communicate that the desire for an IEP or 504 in writing, because once you send that in writing, then they have so many days to respond.
Thanks so much. And Abby, turning it to you about education, just wanted to say, if people were unfamiliar about maybe McKinney-Vento liaisons or what systems work with schools, could you just say a few words about that and how to, get in touch with them?
Yeah. So most systems, or all school systems rather, will have a liaison, a McKinney-Vento liaison that service those children that are homeless or at risk of homelessness or at risk in the school systems. So reaching out to them, finding out who they are, they're going to know who, what, when, where. And these are going to be folks that you want to talk to, especially if you're looking to see if folks are in need of benefits. These individuals oftentimes will sit on a community's continuum of care, which is many agencies that come together to receive funding through HUD and other organizations to provide housing and other services to individuals who are experiencing or at risk of homelessness. So I think that's a great place to start. Also, guidance counselors can be such a good resource. And I know that one of the other questions in there was like, who can become SOAR trained? And the answer is really anyone. So it could be a parent, a guidance counselor, someone who's volunteering. That McKinney-Vento liaison could be a part of it. Because with school age children, or any person who has a history in an educational system or they're close to it, even if it's a transition age youth or young adult, those school records are going to be so crucial to any form of application. So as you're building SOAR in your community, you also want to be building those liaisons and those connections.
Great. Thank you so much to both of you for that information about the education sector. A couple other questions came in. Clarissa, when you shared your story about the difficulties with landlords, I think that really comes up a lot in our community working with housing and homelessness about engaging with landlords. What would be any kind of tips or advice that you have when trying to engage with a landlord or helping engage a landlord on a family's behalf?
So for advocating for my own family, I chose to explain to my landlord or property manager that my kids had issues, and that was usually after we were approved for the place. But I would let them know that my children had disabilities, and then I would also network with my neighbors and let them know, because that seemed to work a lot better than not speaking with them and not letting them know why they're hearing screaming and things breaking. As far as speaking with a landlord or property manager on behalf of a family, I have gone to the landlord and said, I understand that this parent is looking at possibly being evicted. I'm wondering if there's any way that we can work together, because part of my job as a peer is to help parents learn different skills and help their kids learn different skills. So we're part of this program where we're helping the family. And so I'm wondering if you can give a little bit of, grace here, or can you give us a little bit of extra time? And I have had property managers definitely work with us on that. And then also, if the property manager is at the end and says, no way, I'm not working with you, then could you at least give us a little bit of time so we can help the family relocate without getting an eviction on their record?
That is so important. So many things in there that I loved. One, explaining the value of the peer support specialist position. That's something that we feel really strongly about increasing across the country, because you have those different perspectives that you can help intervene on behalf of a family. And so helpful about the negotiating to try to avoid an eviction. Whatever we can do to try to, if the housing situation isn't going to work out, to avoid the eviction on somebody's record, so that they can locate a better housing opportunity. I think that was fantastic. I think we have actually just time for maybe like one or two more questions. I think tagging on from the value of peer support in these programs, Clarissa and Abby, what would you say, like recommendations for integrating more family peer support into your programs, or into everybody's programs who is here today?
Everywhere. Peer should be everywhere.
Yes, I would agree. It's absolutely vital. I mean, we as SOAR trained caseworkers and us who are professionals, and maybe we don't have that lived experience. It's the walk a mile in someone else's shoes. Having people with lived experience is so crucial, not only for your programs, but to be able to actively connect and really speak to those people who are going through similar struggles that they went through. Some of the most impactful SOAR caseworkers or peers that assist them are those who can say, look, I've been through this, it's hard, but we're going to come out on the other end, and getting these benefits will be well worth it. So I completely agree with Clarissa. Incorporate peers, families as much as possible in this determination process.
I would love it if there were peers in police cars, peers in the hospitals, in the ER, peers in, self-sufficiency offices and within DHS or Children's Protective Services.
Fantastic. And just say, if you were like, what would the peers bring to those situations? How would they, kind of like making that difference? So like, I guess I'm asking you to make the pitch for all the organizations so they can go by and make that pitch to their organizations.
Oh my gosh, yeah. So the biggest thing is for a parent is being able to identify that someone else has that same experience. That takes such a huge weight off of their shoulders. Like, oh, I'm not alone. I'm not the only one who has this happening. Peers, because it is our actual role to share our lived experience, that is when we start speaking out about, what that felt like. Because being able to give feedback to providers is like, this is what that thing that you were explaining to me about my child, this is how that sounded to me. Oh my gosh, like, this could cause me to lose hope for my child. If you were describing this lifelong illness, but you weren't giving me anything to look forward to, basically. So a peer can come in and say, no, there are better days ahead.
I love that.
And I'll just add too, for those that are involved with peer organizations, I mentioned earlier that SOAR and the SOAR TA Center, we are very well versed in the adult systems. We are still looking to grow in the child and family serving systems. So we need your help. We would love to have your help in spreading this word and getting additional SOAR trained caseworkers or SOAR trained family members or peers. And if you have any ideas for us, we would love to connect with you further. So please, this is my plug to reach out to your liaison, start a conversation. We are so eager to work with you guys.
Great. Thank you so much. This has been a really valuable hour. I think both in talking about the services there for families, especially those families who have a child with disabling conditions, and also just the message of hope that can bring through peer support. I think that's so important. It's not just about, I'm going to connect them to this service. It's about, I'm also going to help, revitalize their sense that there are better days ahead. Of course, I couldn't have said it better. That's so wonderful. So I think that's a perfect note a very hopeful note to end on. Thank you to all of our attendees today. Again, you should be redirected to an evaluation survey. If not, our team should be putting that link in the chat box to you. Please fill out that survey. You'll receive a certificate of participation for that completion. And stay tuned. We'll get follow-up emails from our centers, both on behalf of the Homeless and Housing Resource Center and the National Family Support TA Center. We are just so grateful for your time today. Stay connected to us and join us for part 2. Thank you for a reminder of that plug. We'll be getting information out to you about part 2 on October 21st. Thank you so much and have a great rest of your day.